Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
This new virus may be more infectious than SARS.
Now spreading across the globe.
A Washington state resident fell ill after returning from Wuhan, China.
We aren't really testing for it.
Fear and panic.
The numbers are going up.
20,000.
It's heartbreaking.
National emergency.
Miss my dad.
It's deadliest.
Stay home. Thousands.
Stay at home.
I get kind of emotional when I think about what I was going through at the time. And what my girls were going through, and my husband couldn't hear me. He couldn't see me.
We ended up causing my mom to lose her life, causing a co-worker of mine to lose his life. So it's a very deep impact, one that through the rest of my life I'll never forget.
I think even that first week of January, we had phone calls between emergency preparedness and infection prevention.
We began to work diligently through our incident management system, which was stood up February the 28th.
All of a sudden, there was a lot of resources sitting around the table.
This is not standard operations. We now are in contingency or crisis planning.
We started up our COVID units and we had people volunteer to go work in them, regardless of the risk that they're putting themselves in and the risk they put their families in, because they know that that's their calling, that's their job, and it's what they love to do.
They truly are worried about me and my safety, and St. Luke's is putting that first.
We're hearing from emergency room staff who say they will soon run out of supplies.
Face masks are starting to become hard to find.
Keeping our staff safe was always the first goal.
We have not had the point where we've run out of masks or really even come close to running out of it.
We went ahead and increased inventories to where we were running about a 45-day inventory starting at the beginning of the year. On level 3 masks, we went from using 500 or 600 today to 5,000 or 6,000 a day.
It's been a continuous challenge to make sure that we have adequacy of our supply of PPE.
It's more than just what were the items, but it's everything behind it to ensure what we can get and how we can get it.
We began aggressively to procure PPE, which was not easy.
We had to go and look outside of what was being produced domestically. We went internationally, here locally in Kansas City, and also then with the volunteers that have been out there in order to find products and to bring them into the health system.
We had adequate PPE, we had the right kind of PPE, and we told people how to use it, and they were diligent in doing that.
Anything that we've ever needed at the testing sites, we've always got.
We were making so many decisions on a per minute, per hour basis that normally would take weeks to make and be approved.
We took action.
St. Luke's health system is taking a big step to help all first responders during the pandemic. It's now offering drive-through testing.
To arrange staffing, the locations, procure the tents, have the IT staff built, to get Wi-Fi, electricity, facilities, security.
That is huge to keep us out there serving the community.
They come through and they thank us for, the job that we're doing when we should be thanking them.
St. Luke's on the Plaza will offer a walk-through site.
St. Luke's says it now conducts its own testing from start to finish.
Way back, we had to call the health department, and the health department had a very limited number of tests.
And it was such that by the time we developed in-house testing, we had tests that we had already sent to LabCorp 7 to 10 days ago that we reran on our analyzer because we were able to get it back faster.
Now, usually our turnaround time is within 24 hours, sometimes less.
The connections that Dr. Estes has had through AHA have really helped us get in-house testing much faster than some of our partners in the city have.
I sit at home, as do others, and listen to the news. Shortages of this and shortages of that, and testing issues and all of those things. And then I look at St. Luke's.
There is an exciting trial underway that aims to find a treatment.
The goal of this trial, called DARE 19, is to basically treat COVID-19 without trying to attack the virus itself.
St. Luke's is adding 163 beds.
St. Luke's Hospital.
Wright Memorial Hospital.
St. Luke's North.
St. Luke's South.
Of St. Luke's Cancer Institute.
Hats off to everyone at St. Luke's East.
Hendrick Medical Center.
St. Luke's Hospitals in the Metro.
The work that the marketing team has done in order to take all the work that the system team has done and get that information out to the public. It's just done an amazing job.
Communication was going to be key.
And all of that requires technology. It requires building dashboards. It requires real-time data. And sometimes that would have taken us months to do. It took us days.
One of the first big things was really the website, what we kept calling the single source of truth in the incident management team. Was a huge thing.
I'd click on that website, try to figure out what has changed since the last 12 hours I've been here, what masks do I need to be looking at.
Created I think the first ever medical staff labor pool.
We increased our ICU capacity. We increased our regular bed capacity to meet that need should it arise.
The no visitor rule has been necessary in order to protect not only our patients, but our frontline workers and the community in general.
And what the COVID-19 pandemic has forced us to do is to innovate.
We were really moving, at the speed of light.
Doctors are finding new ways to treat their patients.
One of the major changes that we went through was our pivot in our ambulatory infrastructure to virtual care.
It's Dr. McGee. How are you doing?
It's called telemedicine.
In a matter of a week, we had confirmed and built out education rollout, technology overviews.
Done over 5,000 visits over the past month.
That's up from just 20 a month before COVID hit.
We utilized all of the technology that we had, from using our robots in rooms with COVID patients so we could minimize coming in and out of the room, using telehealth, and really changing how we approach technology.
Having the Friends and Family program really has been just awesome for our teams to be able to offer.
I think that's so important to have that rounding team to be able to actually see your loved one.
All patients need to have their visitors, need to see their family members. The family members need to know what's going on with their loved ones who are patients in the hospital.
Bobby Green spent 22 days on a ventilator. His mom and best friend lost their fights with COVID-19 while he was in the hospital, but Green survived.
When I was unconscious and they had me sedated, they would put the phone over there and let them talk to me even though I couldn't respond back, and tell me, hey, don't give up, keep fighting. We need you, we love you.
It was so real until our grandson, that's 2 years old, tried to reach through the iPad to touch his grandpa. And he couldn't, and so that really brought tears to my eyes, because I wanted to touch him too. I wanted to hug him.
We really didn't think he would ever even leave the hospital.
I trusted them. I had to. And they made me feel like I could trust them.
It was just unbelievably burdensome for me to realize what the bedside staff is dealing with.
So I haven't seen my family since March 15th or so. I haven't seen my friends since that time either.
I've watched these ladies and gentlemen go through so much. I mean, they've stood in rain, they've stood in the freezing cold.
Everyone's so anxious and so scared and, so nervous about what's going on. But there's so much positivity too that we're finding.
The community as a whole has come together.
This just affirms the value that the community places on our healthcare workers.
To give back to the community that you play in, it feels great.
And that's really important, that's really special, and just makes me feel like, my community has my back.
And it keeps them focused on what they do best, and that's taking care of our community.
I think it will definitely pick up morale.
Some of the distilleries were making hand sanitizer.
2,000 4-ounce bottles a week from them.
People volunteering to make masks.
When they said they needed people to make masks, I said, okay, what do we do? And we have to just do what we can in our little corner.
Everyone's kind of, rooting for our COVID positive patients, okay, let's do what we can, let's get them out of here.
My care team at St. Luke's were the best. They took care of me like I was their own, like I was somebody from their family.
It was so great for nurses to call and even say, can we pray? And would literally pray with me.
Everything that the doctors and the care team did, it worked out well to help me survive to be here today. Everybody out there was cheering for me and everything. Such a big reception. That's my family now.
And here they are going home.
It feels so good when we're able to extubate. It's totally worth the stress. It's so worth it.
I owe my life, and I know that.
I owe my life to that hospital. They are part of me now. And they're going to be forever.
That's part of the hope, for someone who's sick to see someone else that went through it and they're getting out and getting to see their family.
That willingness to empathize with the people that we're helping really has driven a lot of effort in St. Luke's.
We've been nothing but innovative since January.
Every corner, every pocket of our organization has been touched with this.
We have, in fact, operated as St. Luke's Health System. The leadership of Dr. Estes and others has just been amazing.
I think we had great success in all aspects of responding to this pandemic.
Within IT, within biomedicine, within clinical informatics, within education,
chaplains,
marketing,
PBS workers,
St. Luke's Child Care Center,
doctors and the nurses,
clinical leadership.
We are a team and we've responded effectively and realistically.
We nailed it.
Everyone, in essence, turned and said, let's take the hill.
I've learned where strength comes from. I've learned where unity comes from.
To every employee of St. Luke's Health System, I say thank you.
I appreciate you, I thank you, and I thank all y'all for praying for me. And I love you all because you're really making a difference in this world.
One person who's got the virus, spreading it to others, and people not wearing protection. That's how this stuff gets transmitted.
We may be over with the pandemic, but the pandemic is not over with us. The virus is still with us. There is transmission across the country. There are new hotspots.
We live this dual reality of operations in the hospital system, getting back to where they were, but still not forget that the beast lives.
We want to be with our friends. We want to get back to our lives. We want to go to restaurants. We want to go to bars, but we need to be safe. We have a responsibility not only to ourselves and our families, but to our workplace.
It's going to be one of those big moments that sort of shifts a generation, really.
You could feel the pivot happen between how we did things and how we are going to do things.
We have this roadmap to respond if we ever had to do it again.
I think there's a lot that we have to continue to learn about this virus and how we will transition back to business in the coming months.
We have all of the technology, we have all of the ability to care for the sickest of patients, but we do it in a kind way, always with the patient and family mindful, and always with caring for each other. And we didn't lose that in the height of this pandemic and all of its stresses. And to me, that's what we should all be most proud of.